welcome, and thank you for joining us. Before we begin, I would like to thank the many families who have provided their generous contributions. Your financial support will allow ABC to continue to provide these webinars and other educational materials to all affected by bladder exstrophy. I would also like to take this opportunity to thank WebCME for hosting these webinars. We appreciate all the effort the entire WebCME team puts into making these webinars a success. Now I would like to extend a warm welcome to our guest speakers, Emily Haddad and Barbara Neilson. I'm sure that many of you know Barbara. She has led online support groups for exstrophy patients and families, including adults, for the last 21 years. She promotes camps and peer activities for patients and attends the Canadian Ostomy Camp with many bladder exstrophy patients on a yearly basis. Barbara is a passionate believer in family-centered care and is a strong advocate for her patients and families. Barbara will be joining us after the slide presentation for the panel discussion. I had the pleasure of recently visiting Emily Haddad at the University of Oklahoma Health Sciences Center, where she is a licensed clinical social worker in the Department of Urology. Emily's role on her team is to act as the patient advocate, the behavioral health consultant, and a resource specialist. She is seen by her patients as a health coach, one who promotes individual self-confidence in their own medical management. We have over 130 participants calling in from all over the world for this live event. And like many of you, I too struggle with how and when to talk about bladder exstrophy to others. And I really struggle with how to coach my child on how to answer questions and when she finds herself in these difficult situations. This is my daughter, Anna. As I was preparing for this presentation, she was looking over my shoulder at Emily's presentation, and she asked if she could join me. I invite you to have your children join you either live here tonight or after the webinar presentation to share in what others have to say. There's going to be ample time after the presentation to ask questions and to share best practices and provide input to others. So let's begin. I'd now like to turn it over to Emily.
Thank you, Pamela, for that introduction, and thank you for inviting me to do this presentation for you all. Today we're going to be talking about bladder exstrophy, conversations with family, friends, and our medical team. My name is Emily Haddad. I'm a licensed clinical social worker at the University of Oklahoma Health Sciences Center within the Department of Urology. I joined the team in Oklahoma 5 months ago. My role in the team in urology is as I said, the clinical social worker. I also see myself as a patient advocate, educator. I'm a trained therapist, so I do provide therapy to our patients, their families, and I do organize support groups. I'm also a resource specialist to help individuals find resources, whether they're traveling to Oklahoma for their care or they live in the area. And I'm also seen as a support liaison between all the other departments within the hospital and all the other providers that care for your child. Some background about me, my previous positions. I worked in a hospice organization as a bereavement therapist for families. I've also worked as a clinical social worker within the Department of Cardiology and the Department of Psychiatry, specifically with kids with chronic illnesses. And back in the day, I also worked as a camp counselor for kids with chronic illnesses, with heart disease or kidney disease. I've acted as a basketball coach, and I also was a nanny and a daycare worker. I was very lucky to obtain my training at the Hospital for Sick Children in Toronto, Ontario, with their clinical social worker in the Department of Urology, Barbara Neilson, who will join us at the end of this presentation for the question and conversation section. Talking about bladder exstrophy, like talking about anything or learning any new skill, takes practice. And today we're going to talk about some skills and some ideas to practice talking about bladder exstrophy through our lifespan. One of my good friends in social work often says disclosure of our intimate details about our medical issues or intimate details about our life is not an event, but rather a process. And it's a lifelong process to learn about ourselves and create intimate relationships with others. It is this process of sharing these intimate details that creates those close relationships with those that we trust. So, in the beginning, talking to our friends and families about our new baby. From what I know about this situation is from those of you who have shared with me your experience and let me in on your process in learning about your child's health. As I've explained before, part of my role is to help families when they first have their baby born in the hospital. And what I hear from families is that this experience can be quite isolating. It's very difficult to find the language to speak about our new child with bladder exstrophy as we're learning ourselves what bladder exstrophy is. Today we're going to be talking about how to gain that support because when we're isolated, it leads to loneliness, hopelessness, and instead we hope to support families in experiencing the grief process, the grief that is not a completely healthy baby, and the hope that there can be a very positive outlook, a very positive experience, and a long, healthy life for our children that is manageable. One of my colleagues often speaks about the idea of secrets versus private information. What we know is that secrets isolate us. Secrets slowly kill us. Secrets don't allow for our grieving process to take place. However, there's a lot of areas of bladder exstrophy that are very private matters. And so it's finding those people that we trust, taking the risk to share with them, and creating those intimate relationships. What I hear from families is that when we don't step into that fear and we don't share those private details, sometimes it can be very isolating and it can lead to feelings of shame and isolation. So again, we choose those that we trust, we choose the information that we want to share, and we choose how and when we want to share it. A mother said to me the other day that she simply put it, my child has a defect at the very bottom of their abdomen. And that's one detail that they can share, and the other information they can choose to share later on in life or later on as they learn more about their child's health. Talking to our medical team. One of the things that I encourage families to do is to actually document what the conversations are with their medical team. This can be done electronically. This can be done with a physical notebook journal. It's also helpful sometimes to document the providers that you're speaking with and their contact information. After time in the NICU and time visiting several different providers, whether it be in orthopedics, plastics, urology, if the child has other issues, it might be in cardiology. There's a lot of people that you end up meeting, and it's hard to keep track of all of them. So sometimes it's helpful to document all the people that you've spoken to, which can then be used as a helpful way of your teen or your young adult child learning about their history. Oftentimes I see myself as a clinical social worker on the team as a interpreter of medical language. You know, a lot of our physicians, a lot of our surgeons, they're used to using these technical terms that our families who care for kids with bladder exstrophy will become experts on. But at first, some of that language is a bit confusing. So asking for the language that your doctor is using in layman's terms is very important for you to clearly understand what they're talking about. One of the families I worked with recently had a great idea of recording the conversation with the medical team on their phone so that they could listen to that conversation later. The way I interpreted this is that, you know, the family was in shock at the moment. They were feeling a lot of emotion, and it was hard for them to really digest the medical terminology that was being spoken and the information that was being given about their child's treatment plan. So to have that recorded conversation so they could listen to it later felt very comforting to them, and I imagine would be very helpful to many families. The favorite part of my job is connecting families to other families. We had 4 families with bladder exstrophy in our clinic the other day, and were able to introduce them to one another. It appeared to be very helpful to both families that were introduced, and a great way to connect to other families, if there aren't any in your area, is obviously to join the ABC and have communication with Pamela and other board members to connect to other families. When we talked about the beginning of the child's life and the shock and the emotion, there's a lot of information that's provided to families that may be forgotten. I encourage families to sort of confirm with their physicians later in life exactly what happened in the beginning of their child's life. If uncomfortable asking this information after the fact, you can always ask for medical records so that you can read exactly what happened in those surgeries and sort of what the information that was given to you when your child was first born was. Some teams that care for kids with bladder exstrophy have a behavioral health consultant or a mental health provider. Our team in Oklahoma has Dr. William Reiner in psychiatry and myself in social work. We're also very lucky to have a wonderful child life team within our hospital. There's several other teams around the country that have wonderful mental health providers as well. If the team that you're working with doesn't have a designated person, it may also be helpful to ask your doctors, your urologists, to ask for a member within the hospital system to collaborate with your team. This person can offer support. They can act as a liaison between the several providers that you're working with, and they may also help your child through surgery. A child life specialist is specifically trained in that area, and social work and psychiatry also help. Ladies and gentlemen, in case of an emergency, always place your oxygen mask on yourself before assisting any other passengers. This is a metaphor that we can apply to the caregiver caring for themselves. In times of distress, when you're learning about your child's medical issues or you're coping with surgical intervention, oftentimes I hear from parents that they're forgetting to engage in their own pleasures, their own joys. They're putting those aside. They're waiting for things to even out and balance out. They're also not maybe eating as well. They're not sleeping. They're so focused on caring for their child that they're not taking care of themselves. The most important thing for parents is to always take care of themselves first so that they have the energy and they have the space to digest new information from medical providers and also provide care and compassion and patience for their child. So moving on to elementary school children, talking to them about their bodies. What we know developmentally for elementary school children is they have a difficult time expressing what emotions they're feeling and putting those in words. Oftentimes it comes out in behaviors like acting out, temper tantrums, defiance. Oftentimes these behaviors are exhibiting sadness, anxiety, fear, and grief that they're experiencing. What I often notice with children is when we don't give them the details that they need to know about what to expect in regards to surgery or about their bodies, they make up stories. They're very imaginative. This is a benefit of theirs, a skill, and it also gets in the way of them understanding what's going on with their bodies. So that's why it's important for us to give them the information so they're not filling in the blanks. One of the ways that we can help them express their emotion is naming their emotion, and this is helpful for us as adults as well. So when we see a kid acting out, non-compliant with their catheterization plan, we can say things like, I see that you are mad that you have to catheterize right now, but we still need to do it. When they're getting ready for surgeries or they're getting ready for a test in the urology office, sharing with them, it would make sense if you're scared right now, and I am too, but we're going to be okay, and our nurse is going to take good care of us, and our urologist is going to take good care of us. Normalizing that fear is really important. Also, normalizing the fear of being different. This is a fear that all elementary school children may have, and we see it obviously with kids who have different medical needs as well, that people might find out about them and may feel that they are different. Sharing that obvious reality with your child, that everyone has a difference about them. And we know what our difference is. It may be bladder exstrophy, it may be something else as well, but that everyone in their class has something that makes them different and unique. And they don't need to be scared about being the only one who has something that makes them different. Talking about bladder exstrophy at school. One of the roles of your social worker on the team is to act as a liaison between the school. If there isn't a social worker on the team, it may be a nurse, it may be a patient advocate within your hospital. It's important that teachers know about some details of the child's medical status, some of the child's issues about bladder exstrophy. Of course, they don't need to know everything. But what they do need to know is how many times a day your child needs to go catheterize or use the bathroom. And this can be included in their 504 plan. What I hear a lot from families as well is that if they're not sharing this information with schools, oftentimes teachers, other providers in the school are maybe not as accepting or understanding of why the child is taking days out of school for medical appointments. Please don't hesitate to ask your medical team to communicate directly to the school about some of the details of the child's medical needs so that this is understood. Oftentimes, bladder exstrophy ends up becoming a sort of hidden or unseen experience. For example, when your child's classmate breaks their arm, they come back into school, they have a cast. People might give them get well cards. They might sign their cast. When your child leaves for surgery for bladder exstrophy, maybe nothing is said to the class at all. They come back, they don't get any get well cards. No one is providing them that support. And that can be very sad and confusing for a child when they see that other kids are experiencing support for their medical issues. One way to sort of support your kid in this way is through role playing. This is something that I like to do with children as well when they're preparing to return to school, is asking them, what do you plan on saying when kids say, "Where have you been?" What do you plan on saying when kids ask you why you're not participating in gym? Or when kids say, you look fine, you don't look sick, why were you out of school? Sometimes sort of preparing for these conversations can be really helpful. Kids are very creative, they're very imaginative, and sometimes they come up with really, really great ways to respond to other kids, and they can practice these ways of responding at home with their parents, with their siblings before they return to school. Another way to help kids understand how their medical issues sort of intertwine with the rest of who they are is through an activity called social stories. This is really, really powerful for kids of elementary school age. They can obtain assistance to create these stories with their parents, a teacher, a counselor, a family member, somebody from the medical team. The reasoning for social stories is to weave our medical history into our social history. As our bladder exstrophy is only part of us, it's not all of us. Something that also can be included in social stories is other events in our life, such as vacations, birthdays, people who have passed away, people who have been born, and then also weaving into those stories the surgeries that we've experienced and the medical interventions that have taken place. Sometimes it's helpful to include before and after pictures as well, so that the children can have this documented for them later in life. The idea behind social stories is explaining the beginning. I have bladder exstrophy doesn't have me. Then the child documents how they were feeling before their surgery. I was scared to have surgery, but what helped me was my sister writing me a letter and my nurse. Then part of the story is outlining how they got through the surgery and how they feel about themselves having gone through something that was really scary and that they used courage to get through, such as, "I'm proud of myself." Another part of social stories is sometimes using words that may indeed inspire other children who are going through similar experiences. Like, what helped me through my surgery was such and such, and I hope that other kids know that they're not alone, and that sharing their fears with their families may be helpful, something to that extent. I've been speaking with some adolescents in our clinic and some preteens about the idea of letter writing. These letters can be anonymous, but it gives us an activity to do when we're feeling powerless, when we're feeling like we're isolated. We can write a letter to a newborn child or their parents for them to read when they're older. Or parents can write letters to other parents who may have a newborn. You may also, of course, give these letters to your medical team so that they can provide them to other families. The purpose of letter writing is to give us an opportunity to put in black and white the experiences that we've had, the fears that we've had, the success that we've had, so that we can inspire other individuals and let them know that they're not alone. Now, adolescents talking about bladder exstrophy. As in elementary school children, the experience of adolescence and their emotional experience of bladder exstrophy may indeed not come out in language. For some, it may. But in some, it may come out in behavior. It kind of comes out sideways. So sadness, grief, anxiety may indeed come out in irritability, anger, anxiety, which may indeed lead to depression. We know that kids with chronic illnesses are at risk for anxiety and depression due to all that medical intervention that they need and all the time and effort it takes to manage our health condition. But what we also know is that talking about our anxiety and talking about our fears also reduces the depressive symptoms because we're providing ourselves with support. One of the ways that we can help teens is initiating these conversations with them about what they want their friends to know, how they want support, and sharing that information with their friends. A very intelligent and mature teen once told me that when they found that their parents' friends knew about their medical issues, they felt very angry, and they wished that their parents had told them who was aware of their medical issues and about their body. So I would encourage, from learning from this individual, I would encourage families to talk with their teens about who knows about their medical issues and why you shared it with those individuals, because you needed support when the baby was first born. As with young children, teens sometimes need help naming emotions. I've been working with a family who's had difficulty complying with catheterizations. The mom and the daughter have been explaining to me that they've been having a lot of conflict with one another, and they've been fighting with one another about the medical care that the child needs to do. One of the things that we're working on right now is naming that we're mad at bladder exstrophy. We're mad at the needs that bladder exstrophy entails, and not mad at each other. And then, of course, anger is a very normal experience to have. And it's a very understandable and acceptable emotion. However, finding ways to express our anger is sometimes very difficult. Sometimes teens have a difficult time talking to their family. They don't want to burden them with the feelings that they're having. So accessing support to practice these discussions and to gain avenues to talk about these things sometimes may be helpful. That may be asking your medical team to connect you to another family of a teen, or it may be finding a counselor in your area or speaking to the mental health provider on your team. Now, we talked about social stories as a way for kids to learn about their health and to practice talking about bladder exstrophy. As individuals age and transition into adult care and into adulthood, sometimes it's very beneficial for individuals to create their own medical journal. Not everybody in the medical field understands bladder exstrophy. We do have specialists. We do have people who have spent a lot of time learning about bladder exstrophy and becoming experts in the field. However, Sometimes when you visit an ER or you find a new PCP in your area, these individuals might not know as much about bladder exstrophy as we want them to. And it's sometimes a lot of work to educate our medical providers. So using a medical journal can sometimes be a very useful tool in this way. Now, again, this can be a physical journal that we write in, or for those who are electronically savvy, it might be helpful to have information on your phone or use a thumb drive to document this information. Now, as the teen and the young adult age into independence, it's imperative that they know about their medical history. So asking your medical team to help you learn about your surgical history, what medications you were on, why certain decisions were made about your medical care is really empowering, and it also helps the individual gain independence. It's also important for the names of the individuals who have provided care to you to be listed in this medical journal. It's important sometimes for individuals to know about why certain decisions were made when they were children. Sometimes the before and after pictures can be helpful for this, the recorded conversations, but also it's important that parents and children talk to each other about those early decision-making processes, about surgical interventions. As the young adult obtains independence, it's important that they know the medications they're taking and why, the pharmacy that they use, that their parents have been using, and instructions to refill their prescriptions. As we talked about before, these individuals are gaining independence. They may be moving out of the home. We want to give them this information so that we can support their success. It's imperative that we all have an emergency plan when we have a medical issue. And so parents and physicians and our medical team can help us come up with an emergency plan if something were to occur that we needed support. And we, of course, want providers who know about our bladder exstrophy or that we would be able to share information with. One of the ways that we can learn about bladder exstrophy and about our particular medical needs is by asking questions. It's very difficult on the spot to know what our questions are. So I think it's a great practice to record questions that we have for our medical providers before we go into our appointments. All right, talking to love interests as a young adult with bladder exstrophy. I'm excited to hear from those individuals who are going to call in for the question and answer session about the barriers to sharing information with our romantic partners and the benefits to sharing information with those that we're becoming intimate with. It may be a very difficult experience to ask questions of our medical team about sexual function. However, I encourage individuals to start this conversation when they're comfortable so that we can have the facts and become experts on our own bodies. Oftentimes when we have a chronic illness or we have a particular medical issue, we may blame that issue for all of our struggles. But the fear of rejection in regards to romantic interests is not unique to bladder exstrophy. It's a very normal experience. And what we know is bladder exstrophy is only part of an individual. It's not all of them. So as we talked about before, disclosing the information that's comfortable for you, and it can be a little information at first, and then as you become and to trust that person, more information. I met with a 19-year-old female yesterday who explained to me that she shared a little bit of information when she first started dating her significant other, and that when she went through surgery, she shared a little bit more, and she was pleasantly surprised of how supportive this individual was to her. When I spoke to her mom, it sounded like her mom had even more fear than she did about her daughter disclosing this information. Another individual with bladder exstrophy shared with me that living with bladder exstrophy is her normal. She's never known any different. So I think sometimes we underestimate just how confident and relaxed and comfortable someone can be sharing their own intimate information about their bodies. And what we know is sharing intimate information leads to intimate relationships. So explaining what living with bladder exstrophy is like might be the best way to begin that conversation. And again, if we could have some young adults or individuals with bladder exstrophy call in and share what their experience has been like, that might be very beneficial to parents of younger children. So thank you so much for listening. I look forward to hearing from you all. And we're very lucky to be joined now by Barbara Neilson, clinical social worker at Sick Kids Hospital, for the questions and comments portion of this program. Thank you.
Hello, welcome to the Q&A portion of the presentation this evening. We hope you've enjoyed the information so far. At this time, we'd like to welcome you to send in your questions via email or call the number on your webpage on the screen right now. Additionally, you can send them in through the Facebook Bladder Exstrophy page. I know that Barbara had some things she'd like to say, so if you would like to speak at this time.
Sure. Hi, everybody. It's good to see the panel here tonight, and hopefully the people that are out there watching. As I was listening to Emily talking, there were things that were popping into my mind that I was wanting to sort of get out there. And one of the things Emily talked about that I think is really important and crucial is for kids and families to meet other families. But one of the biggest things that I think is really important is for the kids to spend time with other kids with exstrophy without their parents. And camp, rally in the States, camp in Canada, there are camps in Europe, there's camp in Australia, are really, really important times for kids to get together. And that's where they learn how to practice talking to other kids and finding out how other kids have managed. Because it's one thing for adults to give kids ideas about what to say, but there's nothing like another kid giving a kid their information about how they dealt with things. And parents want so much to protect kids. I know if I had a plastic bubble, I would have my son in a plastic bubble and would have had him there for years. But we can't do that. And we have to give the kids the tools to be able to deal with things. And it's not always going to be pleasant. There may be kids who make fun of your kid because they're using catheters or because they have pads or they have a diaper or some other incontinence issue. And kids are going to tease. They're going to tease for all sorts of reasons, and that's a reason to tease. So we need to give our kids the words and the tools to be able to answer that and to answer it without emotion and not to take it sort of in the hurtful way that it's often meant. Mm-hmm. It's also good to have conversations with your kids about why might somebody do something like that. Usually when kids are teasing or bullying, it's because of insecurities that they have about something. I remember once at one of the Bladder Exstrophy conferences that one of our kids who had never been teased anywhere else actually got teased by another kid with exstrophy about her incontinence, and it was really shocking. But I think this other kid felt kind of safe to do it where he was. So being able to talk about that and what that's all about. And I also think along that line, something that I feel strongly about is that because we want, as parents, we want to protect our kids, that often if the kids start to tell you painful feelings or they start to tell you about something, you give them the answers. You want to make it better. You tell them how they should handle it, or you go out and you talk to the parents of the other kid. We need to teach them how to stand up for themselves, how to answer for themselves, and we also need to listen. So I think one of the biggest tools, the most successful tools that parents can use, and really anyone can use when they're talking to someone, when you're asked a question, ask that person, what do you think? Because for sure the kids have some thought before they ask you that question. And often their thoughts include the fears that they have. It's also a lot easier for kids to talk about their fears if they're talking about other kids' fears sometimes, which is also why it's really important to meet others so that they can hear again what some of the issues are that others have dealt with, and how they've managed it. And I think that's really, really important. I've got some other things to say, but I'm wondering maybe what Emily and Pamela think, or, yeah.
Barbara, Anna has a question for you.
Okay.
What do you do in your camps?
They're wonderful. For one thing, we don't sit around, hold hands, and talk about Exstrophy all day. That's not what happens. We whitewater raft. This is at the camp in Canada, which is out near Calgary. We go whitewater rafting. We go on high ropes. There's mountain biking. There is crafts. There's opportunities to decide during the week what you're going to do. So there might be kids who are interested in music who spend the week putting together a musical number that they put on at the end of the week. The kids who come are between 9 and 18, which is pretty close to the age for rally in the States as well. There's always a dance near the end of the week. But then we do have some time. We have one day where we've played Jeopardy, where kids are answering questions. Because we do try to teach, we have kids who say, yes, I catheterize all the time. I always wash my hands before I catheterize. I drink 8 glasses of water a day. But when I see them at camp, they're drinking 2 glasses of water a day if we push them, and they drop the catheter in the toilet and take it out and go to use it. So you see all sorts of things that think, oh my God, that can't happen. So we teach around that. We have nurses at camp that help. And we also do have a couple nights where kids are able to share what things are like for them. And sometimes there's some sad things that kids have talked about, mainly often about teasing or sometimes non-acceptance in their own family. And other kids talk about how they've managed to handle that. So it's like a regular camp. But before we get on the wetsuits, before we get into the whitewater rafts, everyone goes and catheterizes. Or if kids have colostomies or ileostomies, they empty their bags. And everyone drinks. Like we all have water bottles, and we're pushing the drinking all the time so that kids can get used to really doing those things. So it's a lot of fun that way. There's also sometimes water fights with the catheters. But parents, I'm sure, would be horrified. They're clean catheters, but it's a lot of fun. Emily, any thoughts on what I talked about before?
Yeah, when you were talking about the youth rally in the United States, I've heard really good things from individuals who have attended. It seems like it's a lot of a sort of a leadership experience as well. And as like you said, they're not just sitting there and talking about their urological issues or their bladder exstrophy. They're becoming friends, and that's primarily what they're there for. And I've heard from a lot of kids that those kinds of experiences are really, really fun. And when they come back to school, they feel a lot more confident. They have really good, cool people to keep in touch with and know that there's people just like them.
Yeah. I had another thought that I was thinking during the presentation, and that was a big thing that parents can do to really help kids later on is from a really early age. I'd suggest from the time kids are 3 years old that when you're meeting with the medical team, to get your child to ask questions. If your child's shy, maybe you talk about the questions and write down the questions the child has and you ask the doctor. Or if the doctor only talks to the parents, and that often happens, that you then say, doctor, I think, so-and-so wants to talk with you. And make sure that they start talking early on because, again, as parents, we know all the information. We want to make sure we're covering everything, and we don't give the kids a chance to talk. And if you start them from an early age getting involved in their care and asking the questions, they're going to be more involved as they grow up and be more aware of what's going on, and be a lot more prepared to take on their care themselves when they move into independence. And I think that's really important.
Mm-hmm.
So,
at this time, we do have a couple of questions that have come in both through Facebook and email, both concerning this camp. The first one is, where can we get more information about the camp? And the second question that came in was, what can we do to help with the cost from like a sponsorship standpoint?
So I can say for the Canadian camp, if you Google Canadian Youth Ostomy Camp, it will pop up. And there is financial help. For the patients that I see or anyone that I talk with about camp, I let them know about a number of organizations who we can go to first. And the people who run the camp also do fundraising throughout the year, and local chapters fundraise, because most of our kids, they come from across Canada. So not only do they have the cost of the camp, but they also have the airfare to get there. So there's fundraising efforts in order to get kids there, and just about everyone who wants to go is able to go and doesn't get turned away because of money. And I'm pretty sure, Emily, that there's financial help for the kids in the States as well.
Yep, and that camp is called Youth Rally. And if you Google Youth Rally Ostomy Camp, it'll come up. I believe the website is Youth for Rally. And I believe that they also have scholarship funds for individuals, and that people don't get turned away if they would like to attend.
Yeah.
And we have put information in the past about the Youth Rally up on the ABC site, but Barbara, I will work with you after this webinar to make sure that we get the Canadian camp up on our website as well. So anyone who's looking for more information, we will get those links up in the next few days to help facilitate anyone who wants to go to those camps. They'll have an opportunity to explore that as an option.
One of the things about camp that's really, really helpful is for kids who are reluctantly thinking about another surgery. Sometimes there are kids who maybe need a Metrophenol or a bladder augmentation, and they've been really anxious and they're not sure they want to have the surgery. And camp can be a really good time where they can go and hear really honestly from kids, and they'll hear some of the problems, because it doesn't go smoothly for everyone. So they'll hear the problems, but they'll also hear the kids who say, oh my God, I wish I'd done this sooner. This has just been the best thing in my life. In my experience, and I've been sending kids to camp for a long time, and I've been going myself for the last 10 years as a volunteer. And once kids have gone, they go right till they're 18, and then most of them come back as volunteer counselors or actually work at the camp. So it is definitely a really, really useful thing.
We do have another question that's come in. This is from Ashley, and she says, Barbara, that she couldn't agree more with you about the children being around their peers with the same condition. She went to the youth rally in the United States for several years, and she said the experience was life-changing. As a young adult, she's struggling with changes to her medical team. She's had the same doctor for her entire life, and he's become more like a family member than a doctor, but he's no longer practicing. And she's really struggling to connect and feel comfortable with the new doctor. And she's wondering if you have any recommendations for handling that change.
Some of it, and it depends. It sounds like she's already made the change, so you can't really talk about what you might do ahead of time. Mm-hmm. But if she's feeling uncomfortable meeting with the doctor, it may be that she needs to make an appointment to sit down and talk about that, and to recognize that she's not going to get the same relationship that she had with the doctor who operated on her when she was a baby and knew every single thing about her. But she can get an adult relationship with this doctor to make sure that he or she understands what her concerns are. If they had a meeting where they could actually talk about them, talk about things that she's uncomfortable talking about, and really let that doctor know what she's about. And it may be that there is a social worker in the adult system as well that's there. One of the things I know, a lot of the people I've known, and I follow all of our extra-fee patients from the day they're born until they hit 18, and then usually beyond through electronic media, is that if they're going to a teaching hospital, which a lot of you do because that's who knows about extra-fee, is that they make it sort of in the adult system have a lot of fellows or residents following them, and say that you want to see the staff doctor. It may mean that you have to wait longer to see the staff doctor, but you want someone who consistently is going to follow you and know you. And if you're a female, young female, you want to make sure you connect with a gynecologist who has either a knowledge of extra-fee or who can work with the urologist, both around possibly having children and giving birth. Those are really important things that you need a team to help you with.
Yeah. And what I would add to that is, individuals that I've talked to who have transitioned to adult care is that pediatric urologists filled many roles, and it's a big loss not to have them anymore. And so as Barb is saying, it might be a matter of finding multiple people to fill that void, having a urologist and a gynecologist and maybe a social worker.
Okay, very good. We do have a caller that's come in. Eileen from Omaha is on the line. Eileen, what's your question?
Yes, hi. My question is about the Mitrofanov procedure. Our daughter is about 3.5, and during a recent visit, the doctor said that he's planning to do that as her third stage of surgery, the repair. And I just wonder, is that something that is always done or commonly done? Because our understanding is that's something that's usually done in, I don't know, not in every case. And so I wonder what that is, why that might be done. Is there any alternatives to that?
So
That's
part of it, if you were in Toronto, I would probably talk at great length about some of the medical aspects about it, but I'm not in Toronto and you're not in Toronto. And so I think that you need to talk to your doctor about why is it that he thinks your daughter needs a Mitrofanov, and it probably has to do, maybe the bladder needs to be made bigger and they need to make sure that it's emptied really well, and find out exactly why is it that they think that there's a need for a Mitrofanov. One of the things while you're thinking about it, I know a lot of parents spend a lot of time, it seems to me, saying, I really want my child to pee normally. And what you need to know is that for kids who've had Mitrofanovs where it's worked out well, that they're so happy to be dry, and for them it's the new normal. And it's different than how we pee, but the whole thing of being free from diapers and pads is such a relief, and it becomes such a part of their everyday life that it's a very freeing thing for them. And that becomes their new normal. But I watch parents grieve a lot at the possibility of having to have a Mitrofanov.
And how, Eileen, is your daughter?
Yes, hello?
How old is your child?
She's 3.5.
I was going to answer the question.
And so some people would make the argument, too, that the earlier you do it, the more used to it your child would become. As Barb said, it would be their normal for a longer time. So it's really dependent on each family and sort of what they prefer. You know, some folks do benefit from speaking to a second urologist or a second physician. That's always an option available to anyone. For other people, they want to just speak to the provider that they've been working with. But for other people, getting a second opinion can always be helpful. And it might be the same opinion that you're given by two different people. And sometimes that can be helpful, or you're given more options or more information.
Eileen,
Okay,
this is Pam, and I don't have a medical expertise to give you in regards to Mitrofanov, but my daughter Anna here, she had a bladder augmentation and a Mitrofanov after a failed extra-fee, and she was 4.5 years old. So she's been using a catheter since she's been 4.5. And by the time we left the hospital, before we left, she was taught how to self-cath. And that's not saying that I'm not standing right next to her and coaching her along, but by the time she entered kindergarten, Anna was completely independent in that she had the ability to do the whole procedure herself, from knowing that she needed to wash her hands, and that how to fill the catheter with water, how to do her catheter, and she keeps her supplies at school. And it has been, at least for her, very freeing, and has given her the independence that she's needed. So from a social standpoint, for us, it was the right decision to do it sooner rather than later. So, and I'd be happy to talk with you, and Anna would be happy to talk with you too, if you wanted to get a child's perspective on it.
One of the things that when I first got involved and we first started doing the Trophinovs, we tried to do it before the kids started school. What my practice knowledge at this point is that you shouldn't go ahead of it until your child really wants it. And your child's not necessarily going to say, I want a Trophinov. But if your child is really interested in being dry, hates the diapers, and says, I want to be like the other kids. And I know that Hopkins has got some ideas on having your kids do other chores, because your child has to participate. Even if you're doing some of the cathing for them, they have to be able to participate. And if they have no interest whatsoever, you're going to fight, and it's going to be really miserable. So the child has to be really wanting to be dry before you start. And for some of my kids, that hasn't come until they were 9 or 10. A lot of them, it's around 6, 7. But we don't push the way we used to, where we sort of did it before they started school.
Mm-hmm. I have a couple more questions that have come in. The next one is from a 13-year-old who says when they're at school, they have to go to the clinic at lunch to cath, and their peers often ask where they're going and what they're doing, and this person's wondering if there's any advice for an effective answer.
Emily, do you have something so I don't keep talking?
Some people really want that independent private restroom, and other people feel that it separates them from their peers. So I wonder if for this individual it would be an option for her to try different techniques and maybe use the public restroom rather than going all the way to the nurse. And then, what I've heard from other kids that they've used is they might say, I need to go to the restroom before lunch. I need to make sure that I urinate to protect my kidneys. They might use something that feels a little bit more benign to them, doesn't give as much detail. That's an idea. Barb, do you have anything to add to that?
Yeah, because I have a lot of kids who are quite comfortable saying, I have bladder exstrophy, it's a medical problem, and I need to take extra care of my bladder, and I have some supplies I have to use. And their close friends know what that is, and their close friends will often stand up for them if someone else teases them. One of my favorite things that a kid said when he was teased about being incontinent was, I know why I'm incontinent. I have a medical problem. Do you know why you're so rude? And, if you can teach your kids to come up with answers that they feel comfortable with, because it's not right for people to constantly ask, what are you doing? Where are you going? And so you need to learn how to give those kind of answers. So I agree with Emily that you might want to blend in if you're somebody who really doesn't want others to know. You might want to do that, or say, I have a kidney problem, because that does seem to be more benign for some reason other than bladder. I talk about anything to do with the bladder or the genitals, because we haven't talked about the fact that genitals are involved with bladder exstrophy, that it's something that's really hard to talk about. It's below the waist and under the radar, and I think that's why it makes us uncomfortable when we talk to others, when really it's the same as eating, blowing your nose, combing your hair. It's really another another part. And yes, she can be private about it, but it's a medical issue you have. It's nothing to be ashamed of.
And what I've also heard from individuals who have decided to share with their friends is they've been pleasantly surprised about how well their friends responded. You know, they thought they had this thing that was so secret and they weren't sharing with their friends, and then their friends said, "Oh, that's why you go to the bathroom. Oh, okay." And they move on.
Yeah.
We have actually quite a few questions that have come in. The next one is from Nelson in India. Nelson says that his daughter Rebecca was born with incomplete bladder exstrophy, and you're going to have to help me with pronunciation. Is it epispadias?
Epispadias.
Thank you, epispadias. We have done the bladder reconstruction when she was 8 months old, and since then she has diapers. She wears diapers. She's now 7 and has a fixed bladder neck reconstruction scheduled for April 15th at Jipmer Hospital in India. They're preparing her mentally, but your advice to prepare her further is appreciated.
Oh, good. So other ways to prepare her is probably talk about some of the things that are going to happen, like blood work. People, did you say she was 8?
7.
7,
Mm-hmm.
Okay. So it may be uncomfortable for her nurses coming in and looking at catheters between her legs after the surgery or in her suprapubic area.
Mm-hmm.
And so letting her know that that's okay. I don't know, a lot of our surgeons have gone to operate in India, and I know that sometimes things are a little different than they are here. And, you know, in terms of making sure she knows how to ask for pain medication and how they know how to advocate for pain medication after the surgery, those are all really important things to be able to do, depending on how things work in that hospital. Pam might be able to speak to that because I think she was recently in India.
Yes, I know that I'm not sure based on the question that had come in if they would be doing catheterization. I know that culturally in India, that is something that they steer away from. So even if doing a bladder net, I don't know if they're doing an ostomy either. But one of the things that I noted in India is that they don't use spica casts. They use the metal fixators. And that was one thing that I noted that families really weren't that aware of. And so I would be happy to speak with Nelson, and I'll email him after this webinar too to see if he has any questions, as I just spent time with about 100 families there that were going through different procedures, and I'd be happy to talk with him. But I think, as Barbara had said, just to me, a picture says 1,000 words. Just maybe showing her what she's going to look like before the procedure, what's going to be happening during the procedure, and what some of the care that's going to need to take place after the procedure, such as the catheters and the tubes, the fixators, just those things that might seem and will seem scary to a child of that age. I think if they can see the pictures ahead of time, they won't be so shocked when they come out of the surgery.
Mm-hmm.
Thank you,
that following the surgery as well, the medical team will need to continue to observe and assess how she's healing. So she will continue to get exams in her genital region, I think would be important for her to know.
Thank you. We do have another caller at this time, Miranda from the U.S. here. Miranda, what's your question?
Hi. I'm just wondering about other kids that kind of have problems with their scars and what people think about them. Like when I go to the beach, a lot of people like stare, and I'd be far more comfortable if someone would come and ask me about it instead of just stare. And I don't know, do other people have those kind of problems, and how do they deal with it?
Yep. It's one of the things the kids talk about at camp a lot. And one of my favorite kids, I have lots of favorite kids, talks about scars are just like tattoos, but with better stories. So if you can, and actually I'm aware of some kids, glad it's not my son who's put a tattoo, because I'm not a big fan of tattoos, but I know kids who've used tattoos with the scars. I know some kids who get tired of people asking, so they make up stories about the shark attack or something that makes them sound very heroic. And I have other kids who have said, "Oh, I see you're staring at my scar. Were you wondering what that was about?" And actually telling what it's about.
Mm-hmm. And this past summer, I worked at a camp for kids with cardiology issues, and a lot of the kids had open heart surgery, so they all had this scar here, and they had a similar experience. What was interesting there was that the kid that didn't have surgery and didn't have a scar said he felt left out. But one of the teenagers told me there that they spent years not wearing a bathing suit or wearing high shirts, and it just took them time to sort of get comfortable and accepting of their own bodies, see the people staring, and decide, well, if it's somebody that I want to know about my story, I'll tell them or start a conversation, but otherwise I'm going to get back to my friends. But I think that's a common story for anyone who has some kind of scar or memory of surgery that they've had.
Yeah.
We do have another question that's come in over email. How do you and how often do you talk to a 6-year-old about having accidents and not changing right away? I don't want to shame her, but I want her to take responsibility. And then she further added, there were some days where she would go without an accident, and she often wonders if her daughter's just given up. Do you find that other bladder exstrophy kids go through the same feeling?
Do you want to go first, Emily?
Sure. I met with a family recently who said they taught their child how to self-cath at age 4. They did it all themselves for several years, and then 6 or 7 they stopped, and they would have accidents, and they would sit in their clothing, and the parents sort of wondered, okay, what's going on here? And the sense that we made of it is that things were working the way that they were going, and things always work until they don't work. And so at this point, the mom was trying to find important ways to be firm, but also, like you said, not shaming. So I see that you're wet, you need to go change right now before you do anything else, and making sure that they do it themselves. So they're taking care of their own business, and they actually see the results or sort of, feel that independence of, even when I have I'm not only just taking care of myself in terms of doing the casts and everything like that, but even when I have an accident, that's something I take care of as well. And then I've also seen kids sort of go through that period and then come out of it again, and then they go back into it. And so it's not this linear experience of independence. It sort of wax and wanes, just like, me and my flossing.
Yeah. Yeah. I think about that because I used to, for some reason, when my mother told me to brush my teeth, I'd go up and I'd run the water and I wouldn't brush my teeth. Like, it was really stupid. So I can actually relate when kids do stuff like that. I think kids get really tired of it. I see a number of kids in treatment who see me because they're just so sick and tired of toileting being the focus of their life. Some of these kids have exstrophy, some of them have bowel issues as well, so they also have a psychostomy along with having to catheterize, and it seems like the whole focus for them is on their bladder and their bowels, and it's not very pleasant. And sometimes what can happen, kids with exstrophy sometimes really don't know that they've gone. And if you are living like you think, well, doesn't she smell it? Well, no, sometimes you don't. You see all those ads on TV about you've gone nose blind with your pets. Kids will go nose blind with how they are as well. And what can sometimes happen is to figure out on a weekend how long it is before she's wet, and then work out a schedule with the school that she changes before that period of time, whether she's wet or not, so that it's a routine to help her get into that routine. And she may need to talk with someone, and because it is not uncommon for kids to really be tired. Kids want to fit in, especially in latency years, which is 6 to 12. They want to be like everyone else, and having to have a beeping watch or a vibrating watch and have to go and have to drink water gets really boring, and you don't always want to have to do it. And what would be, in my fantasy life. And when I rule the world, everyone will have to drink 8 glasses of water a day and will go to the bathroom every 2 hours, because that's what everyone, whether they have exstrophy or not, should be doing for good bladder health. And schools in Australia actually have a program, and in England they have a program. Good old Canada and the USA are way behind on that.
Thank you. We do have another question that's come in through Facebook, and then I think we're out of questions after that. But the question is from Rohan. My son will attend full daycare later this year. He is 4 years old. He will require assistance to change his diapers. We will have to inform the daycare about his condition and also ask for assistance regarding changing his diapers. What is the best way to communicate this and set the correct expectations?
As a medical team, we help with the daycare. We work with the parents with the daycare. Sometimes myself or the nurse practitioner will actually go to the school or to the daycare, or the daycare staff will come in. We will help them to learn and understand what's going on and develop a plan with them. The same for the schools. It's different in every jurisdiction, and I know it's different where it's sort of what you're allowed to do. So you're going to have to find out what your daycare system allows you to do.
Pamela, do you have any experience in communicating with daycares or schools that you want to share?
You know, unfortunately, personally, I do not, because Anna, again, just due to the condition that we went straight to catheterization. When she had her complete repair, she was adopted from China, and she'd had a failed repair in China. So when she came home, we really didn't have a choice. We were dealt with the medical situation we were dealt with, and so she didn't go to daycare because she didn't have her repair until she was almost 5, and then we kept her home, and she entered school dry. Now she does have, she has pads, and she recently got a watch so she can kind of keep on a schedule, and she's enjoying her watch. But she's, I think I've been blessed with an amazing child, because she's a rule follower, and she is very compliant. About 90% of the time. So right now I'm very lucky. So we'll see. We'll see when we get into the teen years if we'll be having a different conversation.
We do have another caller.
Can I just add to that question, please, Katie?
Sure.
One of our families is working with a daycare right now, and the daycare is questioning why the child isn't potty trained. And I think it is really important, whether you have a medical team that's able to visit the daycare or speak directly to them, if they could even just write a letter saying that this child needs diapers right now due to a medical reason, that might be really important, because they might have expectations of this child's, your child's continence or ability to control their bladder that isn't accurate. And so they need to know that due to a medical issue, that's why he continues to wear diapers or needs to use the restroom in a very orderly way. If your team could write that letter, that might be really helpful.
Yeah.
Okay, thank you. We have Christy from Canada on the line. Christy, what's your question?
I just had 2 questions. I was wondering. Hi, I was just wondering, once they have a Mitrophanoff, can they still leak? And I was wondering, when people talk about accidents, is that because the kids are just getting to the point of overflowing in their diapers without realizing it?
There can be complications with leaking afterwards. Sometimes there needs to be a revision to the Mitrophanoff. I don't see it as much anymore, where there used to be, maybe they didn't tighten the bladder nut quite as tight as they could, so they still leak from below as well. Haven't seen that in a long time, so it would be more likely from the Mitrophanoff. Doesn't happen with everyone. Sometimes it is because kids aren't emptying as often as they should or totally emptying. Sometimes it's because they have an infection. Sometimes it comes and goes. So it can happen.
And what we know too is that, our bowel regimen or how often we're going to the bathroom, number two, also affects, leakage and things like that. So that might have some effect on the leaking.
Number two, is that some sort of American
That's
euphemism?
that's pooping.
Is that pooping or defecating? That's what we call it in Canada.
You don't call it number two?
I just do want to mention, as some of our viewers have pointed out, that we did talk about Mitrofanoff versus other procedures in a recent webinar. So you're welcome to look at the archives for more information. That's what it's there for. So please use it as a resource.
Yeah.
Okay. And it looks like we have another caller. Linda? Linda, what's your question? Linda, can you hear me?
Yes, I can.
Okay.
Do you have a question?
We're ready for your question, Linda.
Hi there. Yes, I'm calling. My daughter had a bladder augmentation about a year ago. My question is that she sometimes has really good days where she's dry for most part of the day, and then I find sometimes later in the afternoon she'll have accidents here and there. But I'm just wondering, is that normal with the bladder augmentation?
I think anything can happen with any procedure. It's not normal. Like, it's not everyone who has had an augment is going to have that happen. And I think it's probably a more unusual situation. I would be looking at and maybe doing a diary of when is she emptying, and is it in the afternoon that after lunch she doesn't go and doesn't empty? Is she maybe not drinking enough? There could be a number of things. Or is that when she has phys ed, and is it when she has phys ed and runs around that she's more, that's a time someone is more likely to be leaking?
Mm-hmm. Okay, I think Linda may have dropped off. We're going to go to Facebook. We have another question here. All right, here we go. Somebody wanted to just mention the age range for the youth rally, and just to be clear that she believes it's for older children, possibly about like 11 to 17 years of age, for viewers out there that are interested in bringing their children to the youth rally. Is that right?
Yeah, I think it is. For Canada, it's 9 to 18. And actually, we have kids who come from the States to the Canadian camp and go there for a week and then go to youth rally for a week in the States as well. So, and we've had some of our Canadian kids go down, so you can go to both.
Okay, thank you. And then the other question that's come in is regarding somebody who has a grandson who's 4.5, and he's already aware that his penis looks a little different from his brother's. And there's been a lot of talk about how to respond to the different voiding issues, but how should the difference in the physical appearance of the genitals of a child with exstrophy be addressed to the child or the adolescent in some cases, because they do just want to be like others and fit in?
Yeah, so it's different how you deal with the 4-year-old than you deal with the adolescent. And for the 4-year-old, it should be within the context of lots of other differences. His brother's nose may be different than his. His brother's may have glasses, hair color. There's lots of other differences, and his penis is different. And actually, his penis is different because it's part of the bladder exstrophy issue. And that part of his healthcare team's job is to see what it is that they can do to help him and to make it work like other penises work. Although he may not pee through that penis, it may work the way he needs it to work. That's what the goal is to have it work when he's an adult and an older teenager. For the older kid and one of the facts is that epispadias penises are usually shorter and wider than what the more regular penises are. And that's sort of a fact of it. Usually they're long enough for penetration, and that's the important thing. So there's lots of aspects of a son needing to get to know his doctor so he can ask questions, and possibly ask questions as he gets older without his parents there, in terms of the sexuality and how that penis is going to function. And he may be sad that it's not like all the others. And I know one of the things we talk about is a lot of men with what fits into the normal range of penises are not happy with their penis. No, and same as women are not happy with their breasts. We're not happy that we're not thin enough. And it's really about learning to accept the body that you have and learn how to make that body work for you. And the team can really help with that.
And I think in response to that, the four-year-old, it is important to acknowledge that he's seeing, kids that age, they see a difference, they compartmentalize, they're seeing shapes, they're learning shapes and how they're different. And it's important to say, yes, you're right. It does look different than your brother's. Some boys' penises look like your brother's, and some look like yours. And sort of just validating what he's seeing is accurate and true.
Yeah.
And for him, it's maybe not even he doesn't even have an emotional reaction to that at this point. He's just noticing that there's a difference.
Thank you. We do have one more question that's come in, and then I think we're going to wrap up. If there are any other questions that come in after we conclude the webinar, those do get sent directly to Pamela, so she'll be able to get back to you in a timely fashion with appropriate answers. So the last question tonight is regarding let me see here. This is from Melissa in Canada, and her daughter has bladder exstrophy. She'll be starting kindergarten this fall, and she's wondering how to handle talking to her new friends' parents regarding birthday parties and sleepovers and play dates.
Good question. Pamela, do you want to speak about this?
Yeah, I'll speak about that and then follow up because I'm not sure I'm doing this right. I do disclose, depending upon the situation. If it's like a 1 or 2 hour play date and it's the first time that Anna or I met the families, I may not get into that conversation. Birthday parties, I would tend to go with Anna, and I would just handle her bathroom needs in that situation. We've done very few sleepovers. We have sleepovers with your adoptive friends. We have sleepovers with families that we're very close with, and there's full disclosure there, and so that's never been an issue. It's our adoptive community, and they know the history well. But Anna has not yet had a sleepover at school, and it's something that we struggle with. So that's why I'd really like to hear what the two of you have to say. Because Melissa, we're kind of in the same place that you are, is we don't really know how to address sleepovers.
I think you need to be open with the mothers or the parents. And again, when my son was young, he only had sleepovers with people we knew really well, and that he doesn't have exstrophy, he doesn't have anything. It's just as a parent, that's what I would want in terms of a sleepover. So you're going to feel comfortable. The same as you would tell about a peanut allergy. You're going to mention if the child's either going to have continence issues or is going to have to catheterize, is going to have to dispose of diapers, that you say that there's a medical issue and this is what happens and this is when you need to be called and this is what she can do on her own. And I think you have to feel comfortable to do that. If it's a school, overnight sort of thing, there needs to be somebody within the school that is going on that overnight, who's one of the chaperones, who needs to know so that you can have a plan about how that can be dealt with. If you're camping or something, how are you going to manage that? Are you going to take a bag and have the stuff to dispose of? So there has to be an adult who understands in case something comes up. I think that's really important.
Mm-hmm. If I could ask a follow-up to that, Melissa's question as a parent, what happens if you go through that and you do disclose, and then the child either that time or the next time has found themselves excluded.
Yeah, and I think that that's a really good point, Pamela. I'm glad you brought that up. When I was going through the presentation, I think that's something that I left out that I is really important, is that when we take that risk in sharing such a private matter, such private information, we are risking disappointment. We're risking, not being happy with the outcome. And, I think that it's important, as Barb mentioned before, we want to protect our kids, or we want to protect ourselves from any hurt. But the reality is that we're going to experience hurt, and we're going to experience people not wanting to be our friends because they find, something happens, or just for any reason. And so it's a normal human experience to sort of have that disappointment. So I'm not sure if the fear or the risk outweighs the benefits of having those fun nights with your friends, and that friend that you trust that accepts you for who you are. And that might come with trialing it with someone that you end up being disappointed by.
I can't imagine someone, if you shared that and then said, well, I don't want that kid. I remember at one of my son's birthday parties, a kid that came to the party who was absolutely wild, and nothing had been said. And when the parents came to pick him up, they said, oh, how did Daniel do? He didn't have his Ritalin today. And they had never mentioned, and it made a lot more sense to me to know that he was on Ritalin and he hadn't had it. And I would have really appreciated that. And I think they thought that if they told me, I would send him away, and I would never do that. No, somebody else might for behavior, but for incontinence, I would think he'd be more likely to be excluded if you didn't tell them and there was an accident, or they found something and they thought, what's this? What the heck is going on? So, and if they do exclude you, that's not who you want to be friends with. Do you want to be friends? If you have a continence issue, do you want to be friends with someone who constantly puts you down for it? No.
Yeah, that's a really good point. I spoke to a 20-year-old the other day who had a surgery that affected, it was on her genitals. And she said to me that she was telling these new friends of hers, and she was really, really excited because they were being really loving and really kind to her. And she said, but you know what? If they weren't, then that would be a really good indication that they weren't a good friend for me to have. And then I would have known right away. It's sort of a way to weed out the compassionate, sensitive, kind people that I want to be friends with.
I'm wondering if I could just throw something else in. I know we said we're wrapping up, and it's something that I think is really important, and it often doesn't get talked about. And it's something I do with my teenagers as they're getting ready to move on, and especially kids who are catheterizing. And it's talking about typical teen behavior. Not every single kid in the world is going to experiment with drink and drugs, but a lot do. And that's something that I talk with them about. So if you are catheterizing and you're going to go out and get drunk, and this has happened to patients all over North America. I'm sure it's happened in Europe and Australia as well, and other continents, where kids have gotten absolutely drunk, have not told anyone their situation, and have ended up rupturing their bladder and almost dying. And so one of the things I talk about is either 1, you don't drink, 2, you drink responsibly, 3, you have a designated catheterizer who knows the situation and can catheterize for you, or 4, you put in a Foley catheter and leave it in. And you talk with the doctor about, this is what I'm doing. Is this going to have any kind of ill effect with my health? And I think it's really important. And just say no doesn't work. And so to be able to have open conversations as kids are growing up is really important. And also, as kids are getting ready to go away to university, it may be necessary for them to catheterize, and it's harder to do if they want to keep it private, if they have to share a room. So that's something we do, is write letters for kids to get accommodation to have a private room if they're in residence, if that's something that they need, or if they have some other things that they have to do with their medical condition. So just as kids are growing, I think those are really important conversations to have with them. about their bodies and taking responsibility, because it's I've heard from urologists all over, there's nothing like the smell of beer in the operating room with this ruptured bladder, and then the kid is in the ICU for a week. It's not pretty.
Well, thank you for the advice. Yes. Okay, well, I think at this time we're going to come to a close. I want to thank both Emily and Barb for their presentations and their knowledge and their time tonight. And thank you, Pam, for organizing this series. And I believe, Pam, you had some closing comments.
Sure. Again, to Barbara and Emily, I really appreciate you taking time out of your evening to support ABC in these webinar series. And I hope all of you that have joined us tonight have found this to be informative and beneficial. As Katie said, please let the questions continue to come in. After this event, we will be archiving the video, but we do not, for privacy purposes, archive the Q&A session. But what ABC will be doing is putting together a frequently asked questions document, and we will document all the questions and answers that happened here tonight, but we will remove any personal information, and we will have that documented with the series as we get it up on our site. And we hope to be a little bit quicker in getting the live webinar. The holiday seasons put us back to getting Marlowe's up, but we should have this one up on the site within the next 2 weeks. So I do welcome you, and thinking if you want to use this as an opportunity to open up discussions with your kids, it might be great for you to sit and watch it with them. We do have a couple of other webinar series coming up. We don't have dates set as yet, but we have 3 doctors. One has already filmed. Dr. Grady will be doing the next webinar. He's from Seattle Children's Hospital. And then following him, Dr. Douglas Canning from Philadelphia Children's Hospital will be doing a webinar series too. We absolutely love to hear topic suggestions from you. We do take those, and this was one that came across loud and clear that people wanted to talk about, how to talk about these. And if you're let us know if you want to have us and have Barbara and Emily even come back and segment this even deeper by age groups. I'm sure they would welcome the opportunity to do that as well. But again, thank you all for taking the time and sharing your questions with us. I know this really helps the entire bladder exstrophy community when you're willing to share your questions and let the panel have an opportunity to share their thoughts with you.
Thank you.
Thank you, Anna.
Yes.
Thank you, Anna, for being with us.
You're welcome.
All right. Well, to everybody watching, thank you, and we will see you next month.
Bye-bye.
Thank you. Bye-bye.